When we talk about health, people often think that the cutting edge of modern healthcare looks like this: smartwatches, robotic surgery, scans and imagery that can reveal exactly what's wrong with you in advance. In fact, sadly, the reality is that it looks much more like this. Most of the data that has been collected is actually stored on paper, which means it's really difficult to access right when you know that you need it, right at that moment when you need that opportunity to detect what's wrong with somebody proactively. And part of the challenge is that our health systems are really struggling to cope with the complexity that's burdening them. 50% of care is actually not evidence-based today, and so it's not that we don't actually know what is optimal. Most of the time, we do know what's optimal, and clinical best practice is available to guide us and steward us when we need to navigate a new example of a patient case. And on top of that, medical error is actually the third leading cause of death in the world. 250,000 people a year in the US die from medical error, preventative medical error. And so this should really sharpen the focus on the extent to which the application of known best practice can really save an enormous number of lives. And part of the challenge that's connected to that is that we really struggle to provide proactive care. Most of our care in hospitals today happens when a clinician has already identified that something has gone wrong and they're reacting to that thing that has gone wrong. So something like 97% of that care is reactive rather than proactive. And that's why we see such runaway costs, which we know are crippling our healthcare systems. In the US, 18% of GDP now growing at 5% year on year. So in many respects, these systems look unsustainable if you imagine where they end up in 30 years' time. And this is sort of understandable when you consider how overwhelmingly complex the day-to-day operation of an acute hospital actually is. So let me give you a cartoon version of what it feels like to work in a hospital like many that you'll be familiar with as a junior doctor. What you typically hear is that pathways are the solution. All you have to do is follow best practice. A patient is admitted, whether by ambulance or recommended by their GP. They're given some kind of history or examination. There's a further investigation. It's identified that they have appendicitis, and so they're given some antibiotics and they're admitted to surgery. And so now our doctor has to remember for an appendicitis patient, what are the optimal sequence of tasks that should happen to that patient during the course of their admission. And she has to remember for that patient at the right time and the right place to do exactly the right thing. But of course, our patient also has an underlying comorbidity of asthma. Whilst they're in, it's noticed that they have an allergic reaction to the antibiotics that they've been given. And after the surgery, it turns out that they have a wound infection. So each one of these events triggers another set of clinical best practices that should be followed, another pathway that needs to be implemented at the right time. And so now our poor junior doctor has to remember 5 pathways to implement the best practice for this one patient. But of course, she's also responsible for at least 8 other patients, and she has to now coordinate all of the things that should happen for each one of those patients, for each one of those pathways, along with porters, nurses, senior doctors, consultants, managers, and so on and so forth. And so in fact, this is an incredibly complicated planning and prediction problem. If you think about it, each one of these circles that have been identified represents a unit of clinical activity, a test or an intervention or a task that should happen in the right sequence at the right time, given full visibility of the entire system. And so we think that this is a real opportunity to deliver the kinds of benefits that we've seen elsewhere in the application of our machine learning algorithms to drive improved efficiencies and more proactive treatment.